Welcome back to the broadcast.
In some of the world's poorest countries, a quiet revolution is taking place. It uses the powerful weapons of education, cooperation, and not least, the weapon of faith. When introduced a decade ago in the Congo, the strategy quickly took root, and it refused to die even after civil war threw the country into turmoil. Stan Jeter has more.
It's a quiet revolution that's transformed more than 100 villages in the Congo. Wherever this program has gone, child mortality has been cut in half. It's resulted in larger and better food crops, and in a growing number of vibrant churches. Who's responsible for these changes? Christian villagers who volunteered to become community health evangelists, known as CHEs.
Here are some CHEs who are doing the vaccination. It's a polio vaccination time by the government. And they have been designated because we have in the CHE program the structure to do this, because we know the people, we know the chiefs, we know the people, and the people know us. So these are the CHEs who have been asked by the government to give the polio vaccines to the children in this area.
Gordon Klassen is field director for California-based Medical Ambassadors International, developers of the CHE program. In village after village, CHE volunteers tackle the most basic health needs first.
Teaching on diarrhea is something that helped, because diarrhea is so common here with the lack of clean water and the lack of knowledge of sanitation and hygiene. And he says, we knew nothing about that. And now we've learned how to take care of children who have diarrhea and also how to help prevent it.
The health evangelism volunteers help villagers clean up their water supply, often a creek or small pond. They teach personal cleanliness, including such simple habits as washing hands. Women are encouraged to take advantage of the tropical sun.
She says that there were many things that they knew nothing about that the CHEs began teaching them about, and one of them was the dish racks, that she didn't know that the sun kills bacteria. And so she's very happy for that, because she's sure that that also helps the health of her children.
By teaching and by example, these CHEs have deeply affected village life.
We were a lazy family. We didn't hardly do any work. And because I wasn't getting paid as a teacher, our family was always sick. The children had diarrhea often. They had intestinal worms. We were a family that was in bad trouble.
But when the community health evangelism program arrived, this villager volunteered for the training.
So I started working, and God blessed the work. I began producing a lot of food. My family became healthy because they had food to eat, and we even had enough food to even feed some of the village people who were in need.
Families that take part in the CHE program share more than food. As God changes their lives, they share their faith with other families in the village. The result, hundreds of Congo villagers have found a vibrant faith in Jesus Christ. Dozens of new churches have been planted, and entire communities transformed. The toughest test for the community health evangelism program came during the Civil War of the 1990s that closed the Congo to the outside world. But the 56 original CHE programs not only survived the war, they actually doubled in number, proving the effectiveness of the CHE concept and the power of the God these Christian villagers serve. Stan Jeter, Christian World News.
According to Medical Ambassadors International, over 50% of the world has never seen a trained medical worker or even heard the gospel. And that's why they've taken a holistic approach to sharing God's love. Currently, more than 2,100 community health evangelists are bringing change to some of the world's poorest communities by giving people the skills and knowledge they need to lift themselves out of poverty.